Welcome to this Alberta Health Services training video for safe client handling for clients with obesity, lift-supported repositioning, and log rolling. The information and guidance provided is based on research and best practices available as of November 2015 and is brought to you by the AHS Workplace Health and Safety Department in collaboration with the Provincial Bariatric Resource Team. The repositioning sling and total lift are used for clients who require assistance to reposition and turn in bed, are unpredictable and or unreliable in physical and mental performance, are uncooperative in behavior, and or unable to follow instructions due to cognitive or physical disability. Inspect and prepare the equipment and confirm its weight capacity. The lift is shown here as EC770 to discreetly indicate extended capacity up to 770 pounds. Ensure that the total lift batteries are charged and that the lift is operational. A ceiling lift is used here, but a portable lift would also work. Best practice requires at least 2 workers to be present when operating a mechanical lift. Where indicated, additional workers should be used to safely complete the transfer. There are different slings for different applications, so ensure you are using the correct equipment for the task and for the client, considering body weight, size, and shape. In this video, the type of repositioning sling being used can be kept under the client. Always refer to the manufacturer's instructions for how to use the lift and the lift accessories. To begin, explain the procedure to the client and how they can assist if possible. Protect the client's dignity by using sensitive language that avoids discrimination from weight bias and respects client privacy preferences. For example, you may say to the client, "Let's make sure we have the right equipment to ensure safety and make this process go smoothly," and "In order to make this process safer and more comfortable for you, we will be using a lift today." Prior to moving the client, check that there are no foreign objects that could become trapped under the client and or within skin folds. For repositioning and log rolling, it is best to have the bed in a flat position. However, clients with obesity may have difficulty breathing in this position due to pressure on the diaphragm and may require the head of the bed to be raised. The client in this video does not have difficulties with lying flat. If the repositioning sling is not already under the client, it can be positioned under the client using a log rolling technique or using a total lift to place the client onto a pre-placed sling. The sling should be level with the client's head, and the client's pillow remains on top of the sling. Move the lift into position, lowering the spreader bar above the client's chest, raising the height of the bed, and if needed, the head of the bed can make attaching the sling easier. For this sling, attach the middle straps of the sling to the spreader bar, ensuring that the hooks face away from the client to avoid injury. Then attach the straps closest to the feet, and finally, the straps closest to the head. Ensure that the straps are attached the same way on both sides. Talk with the client to prepare them for repositioning and advise them to keep their arms within the sling and, if able, to cross their arms on their chest. Raise the bed rails on the side that the client is moving toward. Apply tension to the sling and verify that it is supporting the client and that the client is comfortable and not being pinched, and that the sling attachments are secure. Raise the client above the bed just enough to clear the surface to reposition safely. Lower the bed at the same time so that the client is not raised any higher than necessary. Reposition the client as needed, whether it is upward on the bed or, in the case of this video, to one side of the bed, to ensure that there is enough room to log roll. One worker operates the lift while one or more workers guide the client. Lower the client onto the bed. Once on the bed, detach the sling from the spreader bar. The lift remains in position. Now we are going to show how to log roll using the repositioning sling and lift. If needed, support the client's abdomen with the draw sheet or abdominal binder to manage unexpected shifts in client weight. Place the bed rails up on the side the client is being turned toward. Position the spreader bar parallel to the edge of the bed. Adjust the position of the spreader bar and or the bed height to make the sling attachment easier. The worker on the side the client is being turned toward ensures the sling is aligned with the edge of the bed. The worker on the other side attaches the 2 middle straps of the sling to the spreader bar. Talk with the client and prepare them for the log roll, advising them to keep their arms within the sling and, if able, to cross their arms on their chest. Apply tension to the sling and verify that the attachments to the spreader bar are correct. Also check that the client's skin is not being pinched and that their limbs are in a safe position. The worker operating the lift continues to raise the spreader bar while the other worker guides the client to log roll into a side-lying position.
The client should never be raised off of any underlying surface more than is required or be left unattended during any lift procedure. Use the lift or place passive devices to stabilize the client in supported side lying as demonstrated in this video. Detach the sling from the spreader bar. Move the lift away from the client and dock it. Remember to place all the bed rails up. For more specific product information and options, please contact the vendor directly.
Thank you to Alberta Health Services, the Canadian Obesity Network, and the University of Alberta for contributing to the creation of this educational video. Remember, stop, look, and listen. Reduce the risk of injury by asking yourself 3 questions. 1. What can the client do? 2. What equipment is available to complete this task? And 3. How can I get into a good body position for this move or transfer? Thank you for viewing this video. Now it is up to you to take the information from this video and put it into practice in your job and workplace.